Hello, everyone. Today, we're going to explore the different types of anemia and their causes. Let's dive into the fascinating world of red blood cells and hemoglobin. What is anemia? Anemia is a condition in which the number of red blood cells, or the hemoglobin concentration within them, is lower than normal. Hemoglobin is the main protein in red blood cells that carries oxygen from the lungs to the rest of the body. When hemoglobin levels are low, your body doesn't get enough oxygen, leading to symptoms like fatigue, weakness, and shortness of breath. Diagnosis of anemia. Males, hemoglobin levels less than 13 gram per deciliter. Females, hemoglobin levels less than 11 gram per deciliter. Let's discuss the vital roles of red blood cells and hemoglobin. Red blood cells, or RBCs, are disc-shaped cells that deliver oxygen from our lungs to every part of the body, thanks to hemoglobin, a protein they contain. Hemoglobin binds to oxygen in the lungs and releases it in tissues where it's needed. RBCs also pick up carbon dioxide, a waste product, and transport it back to the lungs for exhalation. Additionally, RBCs help maintain our blood's pH balance, essential for biochemical reactions. Hemoglobin also aids in buffering the acid-base balance of our blood, keeping our internal environment stable. Classification of anemia. A. Anemia caused by blood loss. B. Anemia caused by decreased or faulty red blood cell production. C. Increased red cell destruction, hemolytic anemia. A. Anemia caused by blood loss. Anemia from blood loss happens when the body loses more blood than it can replace. Common causes include gastrointestinal conditions like ulcers or hemorrhoids, heavy menstruation, trauma, surgery, and childbirth. Certain medications and disorders like hemophilia also contribute to blood loss. 1. Gastrointestinal conditions. Ulcers. Open sores in the stomach lining can bleed. Hemorrhoids. Swollen veins in the rectum can cause chronic bleeding. Gastritis. Inflammation of the stomach lining may lead to blood loss. Cancer. Tumors in the gastrointestinal tract can cause bleeding. 2. Nonsteroidal anti-inflammatory drugs, NSAIDs. Aspirin and ibuprofen. These can cause stomach ulcers and gastritis, leading to bleeding. 3. Heavy menstruation, linked to fibroids. Non-cancerous growths in the uterus can cause heavy bleeding during periods. 4. Post-trauma or post-surgery. Injury or surgical procedures can result in significant blood loss. 5. Blood loss at delivery and the immediate postpartum period. Childbirth. Women can lose a considerable amount of blood during and after delivery. 6. Hemophilia. Genetic disorder. Impairs the blood's ability to clot, causing excessive bleeding. Anemia. Caused by decreased or faulty red blood cell production. Disturbed proliferation and maturation. Marrow replacement. 1. Disturbed proliferation and maturation. Defective DNA synthesis. Defective hemoglobin synthesis. Megaloblastic anemias, caused by deficiency or impaired utilization of vitamin B12 and folic acid, leading to the production of abnormally large and dysfunctional red blood cells. Anemia of renal failure. The kidneys produce erythropoietin, a hormone that stimulates red blood cell production. When kidneys fail, erythropoietin production decreases, causing anemia. Anemia of chronic disease. Conditions like infections, cancer, or autoimmune diseases can trap iron in cells, making it unavailable for red blood cell production. Anemias of endocrine disorders. Disorders of the thyroid, adrenal glands, or pituitary gland can affect red blood cell production. Defective hemoglobin synthesis. Defective heme synthesis. Iron deficiency and sideroblastic anemia lead to inadequate heme production, an essential component of hemoglobin. Defective globin synthesis. Thalassemia is a genetic disorder affecting the production of globin, a key component of hemoglobin. Marrow replacement, primary hematopoietic neoplasm. Acute leukemia, a type of cancer that starts in the bone marrow, leading to the production of abnormal white blood cells and reduced red blood cells. Myelodysplastic syndromes, a group of disorders caused by poorly formed or dysfunctional blood cells. Marrow infiltration, myelophthisic anemia. Cancer or other diseases invade the bone marrow, impairing its ability to produce blood cells. Metastatic neoplasms, cancers from other parts of the body, can spread to the bone marrow, affecting blood cell production. Disturbed proliferation and differentiation of stem cells. Aplastic anemia, a rare condition where the bone marrow fails to produce enough blood cells. Pure red cell aplasia, a condition where only red blood cell production is affected. C. Increased red cell destruction, hemolytic anemia. 1. Intrinsic, intracorpuscular. 2. Extrinsic, extracorpuscular. 1. Intrinsic, intracorpuscular, abnormal membrane, spherocytosis and elliptocytosis. These conditions cause red blood cells to have abnormal shapes, leading to their premature destruction. Enzyme deficiencies, glucose 6-phosphate dehydrogenase and pyruvate kinase deficiencies, lead to the breakdown of red blood cells. Disorders of hemoglobin synthesis, deficient globin synthesis. Thalassemia affects the production of globin proteins in hemoglobin. Hemoglobinopathies, conditions like sickle cell anemia cause abnormal hemoglobin, leading to the destruction of red blood cells. Membrane defects, paroxysmal nocturnal hemoglobinuria, a rare condition causing red blood cells to break down. 2. Extrinsic extracorpuscular, autoantibody-mediated. Isohemagglutinins, conditions like transfusion reactions and Rh disease of the newborn involve antibodies attacking red blood cells. Autoantibodies, conditions such as idiopathic anemia, primary autoimmune disorders, drug-associated anemia, and systemic lupus erythematosus involve the immune system attacking red blood cells. Mechanical damage to RBCs, microangiopathic hemolytic anemia, conditions like disseminated intravascular coagulation, cause red blood cells to be damaged as they pass through small blood vessels. Thank you so much for watching. If you enjoyed this video and found it helpful, don't forget to like, subscribe, and hit the bell icon for notifications.